Hello guys, this is Dr. Ajinkya here. So guys, today's lecture is going to be all about the bony anatomy of the orbit. So basically this is going to be a 3D anatomy study. So I have a 3D anatomy model over here. So I'll be talking about in brief the 3D detail of each and every bone that's forming the orbital bony anatomy. So this video is really important for those who are in the first year MBBS as well as a third year MBBS because they get asked a lot about the short notes in the theory exams. Also, for an ENT resident, for a final year PG exam going student, this is of real importance because we can see, as you can see over here, I'm going to be also talking about the orientation of the inferior orbital fissure, the superior orbital fissure, and the optic canal as well. So in relation to the orbital cavity. So for them, it's really important. But basically, this question is of prime importance for those who are ophthalmic surgeons, final year students. They get asked a long question on this, on the entire anatomy of the orbit. So me being a skull-based surgeon, I also have to deal with most of the times through nose the medial half of the orbit. So it's for me and all the skull-based surgeons out there really important that we should be knowing the anatomy of the orbit as well and the bones forming the orbital bony anatomy, because we are the ones basically that deal with the sphenoid sinus surgery and the sphenoid bone. So majority of this thing we also should be very much clear about. So let's begin. So what I'm going to do is I'm going to go through specific points as in which bones form the anatomy and which bones are in relation to the orbital cavity. So my first point is going to be about the bones forming the orbit. Okay, if I can just zoom this for you guys, as you can see over here. We have 7 bones in general to start with, right? So the 7 bones are basically the frontal, zygomatic, maxillary, palatine, lacrimal, ethmoidal, and sphenoid. So I'm going to just give you a rough figure, just going to give you a rough estimate where exactly these bones lie. So as you can see over here, the frontal bone, the entire bone in blue, which as you can see over here, this entire bone is the frontal bone, and if I rotate this, you can see this is the entire frontal bone. So that's the frontal bone. Then we have this zygomatic bone over here. The green one is the maxillary bone, as you can see. The blue one, the very short bone, which is in the most posterior aspect, as you can see over here. If I zoom this, you can see this. That is the palatine bone. We can see the lacrimal bone over here in the pink. That's the lacrimal bone over here. That's the ethmoidal plate, as you can see over here, this one in the middle. So the ethmoidal plate is nothing but the lamina papyracea, a part of the ethmoid bone. So, and the last one is a sphenoid bone. So whatever you see in the yellow in the posterior most aspect over here, that is all but sphenoid. That is nothing but the sphenoid bone in extent. So we have these 7 bones in general for that forms the entire orbital bony anatomy. So now I'll be talking about in brief about the bones that form the anatomy. So basically, what is the orbital cavity? Okay, what is the orbit? Now it is a pyramid shaped orbital cavity. Now as you can see over here in this photograph, this is a case of a right-sided orbit. So this is a right side orbit, as you can see, and this is also a right side orbit, as you can see over here. So if I compare this together, we can see the superior orbital fissure right here, the exact shape. Now it's shaped like a comma. We have the inferior orbital fissure over here, and we have got the optic canal over here. So we can just have a rough estimate. We can compare these 2 images and we can learn the entire anatomy of the bony orbit. So basically the bony orbit is nothing but a pyramidal shaped cavity which has got 4 sides. That's the roof, the medial wall, the inferior, that's the floor, and the lateral wall. So 2 walls, 1 roof and 1 floor, and the apex and the base. Now we all know that the orbital cavity is directed posterior medially towards the optic canal. So the apex lies at the optic canal. So the apex is directed posterior medially towards the optic canal. And the base is nothing but the orbital rim. So whatever you can see over here, that's the orbital rim. The orbital rim is the base of the orbital cavity. So we got 4 walls, 1 apex and 1 base. So that's what you need to remember. The 4 walls I'll be talking about in short, brief description. The first one being the medial wall. Now, I'll be talking about the medial wall and the bones forming the medial wall. For that, we need to understand it on a tabular format. So I'll just give you a table over here. Okay. Let me just zoom in this for you guys. So we're going to deal with the medial wall first. Okay. So the medial wall consists of 4 bones. Now, what we read in the very beginning was that the bony orbit is formed by 7 main bones, right? So individually, if we go and select the medial wall, we're going to find 4 bones, or you can say the 4 parts which can form the medial wall. Now it's from the most anterior to the most posterior aspect. So we can do it from here. So the most anterior is the frontal process of the maxilla. Now, as you can see over here, the structure which you can see in the green is all maxilla. So the frontal process of the maxilla is this one. This is the frontal process of the maxilla right over here. That's the most anterior medial wall. Then posteriorly, immediately we get the lacrimal bone. Now the thing which you can see over here is the lacrimal bone, as the labeling suggests on the screen. That's the lacrimal bone. So that's the frontal process of the maxilla. That's the lacrimal bone. That's the ethmoidal plate. So it's a part of the ethmoidal bone. Basically, we know this bone as the lamina papyracea, right? So that's the most thinnest part of the medial wall. And basically, the medial wall is considered to be as the most thin part of the bony orbit. So that's the ethmoidal plate, also called as the lamina papyracea. And the most posteriorly, we're going to get the sphenoid body. So the sphenoid body, once we enter the sphenoid sinus endonasally, we see the lateral wall of the sphenoid sinus being the medial, posterior most medial wall of the bony orbit. So 1, 2, 3 and 4 structures forming the medial bony wall of the orbit. So that's the most important part of the medial wall. Now, if we go towards the roof, as you can see over here, we go towards the roof. Now, what you can see on the screen over here is that only 2 bones form that roof. Now, the majority part of the roof is formed by the orbital plate of the frontal bone. Now, if you can see clearly over here, if you look very carefully, the entire structure in blue over here is the frontal bone. Now, as you can see over here, that's the orbital rim. That's the superior most orbital rim. That's the supraorbital notch. That's the supraorbital foramen. Okay, so what you can see over here, this is the inside of the orbital cavity. If I turn this, you can understand it much better. That's the zygoma over here, and that's the orbital cavity inside. So as you can see, majority of the roof is formed by the blue portion. That's the frontal bone. And posteriorly, if we go, we can see the lesser wing of the sphenoid bone. Now, what you can see in yellow is the sphenoid bone. Now, there are 2 structures which we can see in yellow. The one which is on the superior aspect like this is the horizontal one. That is the lesser wing of sphenoid. And the one which you can see over here, the majority is the greater wing of sphenoid. So the lesser wing is above, the greater wing is below. So the roof is formed posteriorly by the lesser wing of sphenoid. So only 2 bones form the roof, okay? So majority is the frontal, a small part in the posterior aspect is formed by the lesser wing. So we saw that in the medial wall, 4 bones formed it, and on the roof, 2 bones form it, okay? So that's the roof and the medial wall. The next we go on to the floor and the lateral wall. Now, if you look very closely over here, now this is the entire floor of the bony orbit. Now, that's the superior orbital fissure, that's the inferior orbital fissure, that's the optic canal, as you can see over here. So if I turn this like this, you can see this is the entire floor over here. Now, what do we know about the floor? Now, as you can see over here on the screen, 3 bones form the floor. The very first one is the orbital surface of the zygomatic bone, which is anterolaterally. So as you can see over here, this is the most lateral aspect. If I zoom out, If I zoom out the image, you can have a much clearer idea. This is the entire orbit. That's the cheekbone, that's the zygoma, that's the frontal bone, that's the frontal process of the zygoma, and this is the zygomatic process of the frontal bone. So that's the nasal bone, that's the frontal process of maxilla, and the entire green is the maxilla. And we have the nose over here. So as you can see, we are talking about the floor of the orbital cavity. Okay, so we consider first the orbital surface. As you can see over here, if I zoom in, this is the surface of the orbital part of the zygomatic bone that forms much of the anterior lateral part of the floor. As you can see over here, that's the anterior lateral part. The second part is formed by the orbital surface of the maxilla. Now, these are not processes. Remember that. These are not processes, but these are surfaces which form the wall, the floor of the orbital cavity. The third one, which is a very small part, which is very hard to miss, which is on the most posterior aspect. You can see a small, tiny blue color bone over here. Yeah, you can see this bone over here, the small blue color bone, that's the Palatine Bone. So that is nothing but the orbital process. Now it's a process of the Palatine Bone. So three bones, as I can show you here, the three bones were this part of the zygomatic bone, this part of the maxillary bone, and this part of the Palatine Bone. That's the floor of the orbit. So we are done with the roof, the medial wall, and the floor. Now remaining is the lateral wall. Now, as you can see over here, the lateral wall is composed of two main bones. That's the greater wing of sphenoid and the orbital surface of the zygomatic bone anteriorly. So as you can see, the zygomatic bone is a common bone which forms both the lateral wall and the floor of the orbit. Okay. So as I told you before, this is a lesser wing of sphenoid. That's the greater wing of sphenoid. So the lesser wing, now remember this in a very easy manner. It is a lesser wing, still it is at a higher level. So it's the opposite, right? So lesser wing is at a higher level. That is why it forms the roof. And the greater wing, which is at a lower level, which is quite the opposite, right? Greater wing is at a lower level. That's why it is forming a lateral wall. Okay, so this is how you can remember that in your exam. So this is how the lateral wall is formed. So this entire thing is the lateral wall. This is the roof. That is the medial wall, and that is the floor. Now, once we know which bone forms which wall and which side of the orbital cavity, we need to really understand what is the relationship of these walls to the orbital structures and what landmarks we can have, what foramens, what fissures lie in which wall. So that is also a really important question. It may come in theory, it may come in a Viva question. So what I'd like to do is I'm going to minimize this and I'm going to keep these two together. So let me just zoom out so I can show you it on a much better platform. Okay, this one as well. Okay, so what you can see in the screen is that I'm going to show you some bony anatomy so that the bony anatomy of yours becomes really strong. So let me just zoom in this for you guys. So what we saw on the 3D model was something very much similar to this, what we can see here right now. So this is the inner structure of the orbital cavity. This is the orbit as such in whole, along with the orbital cavity. So what you can see over here, this is the right side, this is also the right side. So right side, this becomes the lateral, this becomes the medial, this is lateral and this is medial. You can have this for your reference on the top right bottom, the yellow square. That's the roof and that's the floor. As you can see, this is lateral and this is medial. So I'll be very fast with this, so to save time. So what we have on the lateral aspect is the superior orbital fissure and just above. So if we consider the roof, now this is the roof of the orbital cavity, we have three important landmarks. Okay, so we have three important landmarks in the roof. That's gonna be this one. Okay, so if we take the roof, we have the lacrimal fossa, we have trochlear fossa, and we have the optic canal. So these three landmarks lie in the roof and nowhere else. So you got to be oriented to you got to orient yourself with the 3D anatomy as well. So if someone asks you lacrimal fossa, you gotta say it lies in the superior, lateral, and the anterior aspect of the bony anatomy of the orbit cavity. So it hosts the lacrimal gland. That's it. So you gotta draw the lacrimal fossa on the top lateral corner over here. So that comes in the roof, and if in the roof, it means that it comes under the frontal bone. The second one is the trochlear fossa. Now, this trochlear fossa has nothing to do with the trochlear nerve. It just acts as a trochlear or a pulley or a support to the tendon of the superior oblique muscle. So as you can see over here, the trochlear fossa you can see at the same level but on the medial aspect superiorly. So that's the trochlear fossa you can see along with the lacrimal fossa. And the third very important point is the optic canal. Now remember, this is very important, as I can show you over here. As you can see, this is the optic canal. Now the optic canal is completely within the lesser wing of sphenoid bone. As you can see, it has no relationship with the greater wing of sphenoid. Okay, so this is a greater wing of sphenoid. In no way it is connected to the optic canal. So the optic canal is purely within the lesser wing of sphenoid. Okay, so that you should be really having be basic clear about. Okay, so that's the lesser wing and the optic canal. So these three structures lie in the roof, and as the optic canal transmits the ophthalmic artery and the optic nerve. So lacrimal gland, superior oblique muscle, and the ophthalmic artery along with the optic nerve in the optic canal. So next we go on to the floor. Now same three structures which are really important on the floor is the inferior orbital fissure. As you can see over here, this is the okay, that's the inferior orbital fissure. So it's very simple to remember that the inferior orbital fissure comes under the floor, okay, and nowhere else. So three specific structures in the roof, three specific structures in the floor, three specific structures in the medial wall, and three specific structures in the lateral wall. So we have got three structures on each wall. So that's a rule of three. You gotta remember, three structures on each wall you're gonna find. So we were on the floor. The first thing you're gonna find is the inferior orbital fissure. So the inferior orbital fissure is in the floor, and if I can show you this here, that's the entire inferior orbital fissure in the floor area. That's the one thing. Now I'm gonna make a separate video about the inferior and the superior orbital fissure in detail. So for now, it's just for the anatomy basis. I'm showing you the IOF and the SOF. So we saw that. The next one is the infraorbital groove. As you can see over here, we can see something, the infraorbital groove along with the infraorbital nerve and the infraorbital artery. Okay, so if I can show you on the 3D model over here, you can clearly see that's the floor. Along the inferior orbital fissure, you can see some depression over here. That is nothing but the inferior, or you can see the infraorbital groove. Now, many people I saw, many students confused about the root of the infraorbital nerve and the infraorbital artery. Now, as you can see over here, guys, this is the maxillary sinus, right? If you go inside this, you're gonna get the maxillary sinus. Now, posterior wall and the superior wall junction of the maxillary sinus lies the pterygopalatine fossa. Like posterior to the maxillary sinus, you're gonna have the pterygopalatine fossa. That fossa consists of the maxillary nerve. The maxillary nerve, which is the V2, it comes out from the foramen rotundum, right? FR. The foramen rotundum consists of the V2. That V2 comes from posterior to the anterior aspect from the foramen rotundum into the pterygopalatine fossa. And in the pterygopalatine fossa, that V2 ascends upwards, and in this region, okay, in the region of the superior wall of the maxillary sinus, it continues as the maxillary nerve, and this exits from this maxillary sinus and enters here in the groove that is called as the infraorbital groove, and here along with the artery. So the artery enters into the orbital cavity and the nerve exits outside through the infraorbital foramen, which you can see outside on the cheekbone, which is right here. As you can see over here, you can see this is the infraorbital foramen. So whenever you're doing a Caldwell Luke surgery, you can see this infraorbital foramen, which is about 5 mm below the inferior orbital rim, right? So that's the infraorbital foramen. That's the infraorbital groove. So the nerve travels through this groove and exits from this infraorbital foramen and supplies the upper teeth and the gingiva. So the artery ascends into the orbital cavity. That's the infraorbital artery. Okay, so this is how the course of the artery and the nerve is actually. So next we move on to the second point, which was the origin of the inferior oblique muscle. Okay, the origin of the inferior oblique muscle, as you can see over here, this depression over here medially and inferiorly, you can see the origin of the inferior oblique muscle. So you can, on the 3D model, you can see a depression somewhere around here, far off from the groove. In this region, you can see the origin of the inferior oblique muscle. So you got to be really careful about that. So that was the floor and the lateral wall, the roof. Okay, so on that was about the roof and the floor. Okay, so if we come to the medial wall, now it's very important to understand this. On the medial wall, there are a few important landmarks. The very first one is the lacrimal groove and the lacrimal apparatus. As you can see over here, that's the lacrimal groove, which is actually in the junction between the lacrimal bone posteriorly and the frontal process of the maxilla anteriorly. So if you can see the 3D model over here, this was the frontal process of the Now, this is really important for the ophthalmic surgeons and the endoscopic ENT surgeons to know exactly the anatomy of the lacrimal fossa and the lacrimal gland and the lacrimal apparatus. So the lacrimal fossa is different and the lacrimal sac or the lacrimal groove is completely different. Okay, lacrimal fossa is for the lacrimal gland and the lacrimal groove is for the lacrimal sac. So as you can see, this is the anterior frontal process, nasal process of the maxilla, and this is the lacrimal bone. In between, you can find a groove which hosts the lacrimal sac, which continues as the nasolacrimal duct and which opens up into the inferior meatus somewhere around here. Okay, so that's the pathway of the nasolacrimal duct. So that's one thing you're going to find. So I'm going to make a separate video on the entire anatomy of the nasolacrimal duct and the valves in a separate video in some time. So that was the first depression which I could see. Next one is the anterior and the posterior ethmoidal canal. Now, for the ophthalmic surgeons who go from the exterior route and for the ENT skull-based surgeons who go from the endonasal endoscopic route, the anatomy of the anterior and the posterior ethmoidal artery is of real importance. Okay, so I've covered the anatomy of both these arteries in my previous lecture. For the link, I'll post in the comment section below. You can click on the link and find that video, and you can read about the anterior and the posterior ethmoidal artery as well. So on the 3D model, if I can show you over here, you can see very clearly, you can see a small foramen over here, right? That foramen, this one is the anterior, this one is the posterior. Okay, so it is at the junction of the frontal bone and the ethmoid bone, also called as the fronto-ethmoidal suture, anteriorly and posteriorly. So this is the foramen through which the anterior and the posterior ethmoidal artery exit into the nasal cavity somewhere around here in the skull base. Okay, so that is all about the medial wall important landmarks, and the final one which is remaining is the lateral wall. Okay, now this is of real importance for the MBBS students, basically because of the Whitnall's or the zygomatic tubercle may come as a short note for you guys. So we have the superior orbital fissure. Now it's of real importance to understand that the superior orbital fissure comes under the lateral wall and nowhere else. Inferior orbital fissure comes in the floor. The superior orbital fissure comes in the lateral wall. The optic canal comes in the roof. So this is how you differentiate these three together. Okay, so superior orbital fissure I'll cover up in the next video. So we come to the next is zygomatic foramen. As you can see over here, we have this foramen for the zygomatic nerve inferiorly and anteriorly. So that is for the zygomatic nerve to pass. And this is the Whitnall's or the zygomatic tubercle. As you can see over here, that's a small tubercle actually. You can see over here the Wittnall's tubercle. It is basically for the attachment of the suspensory ligament, palpebral ligament, and the lateral check ligament. So these may also come as MCQs for the entrance exams, for the MCQs in the theory exams, for the ophthalms and the ENTs and the MBBS people out there. So you got to be really careful when you read about the Wittnall's or the zygomatic tubercle. It comes under the lateral wall of the orbit, and it gives attachment to these 3 ligaments. So you may get an MCQ that it gives attachment to all 3 except, okay? So you will have the answer. So that is all about the relationships of the orbital cavity and the orbital anatomy. So this is all about the bony anatomy. So if at all I need to show you, now the clinical importance is the last point which you have to mention in your short note or a long question, that what exactly is the clinical anatomy. So basically remember that in tumors, in juvenile nasopharyngeal angiofibroma, any orbital tumor, any eyelid tumor, or any bony tumor or soft tissue tumor of the orbit or the nasal cavity entering into the orbit may enter the middle cranial fossa, the different temporal fossa, the pterygopalatine fossa, the cranial cavity, the brain, the meninges. So through which foramen? So in short, I'll tell you about that if I zoom in this for you guys. As you can see over here, this is a superior orbital fissure. This is the optic canal, basically a part of the orbital apex, right? Now, orbital apex is nothing but the anterior communication or the anterior continuation of the cavernous sinus. And as we all know, cavernous sinus is a part of the middle cranial fossa and not the anterior cranial fossa. So if a tumor arises in any of the part of the orbital cavity, it may enter through this superior orbital fissure, this optic canal, into the cavernous sinus, and through that into the middle cranial fossa, and may enter into the intracranial cavity. Similarly, we can have this inferior orbital fissure, right? Now, if I say that the inferior orbital fissure has communication to which part, then you will definitely, you have to answer that the inferior orbital fissure from the orbit communicates anteriorly to the infratemporal fossa and posteriorly to the pterygopalatine fossa. This is of huge importance for all of you out there, for your MCQs and everything. So the inferior orbital fissure anteriorly communicates from the orbit to the infratemporal fossa anteriorly and the pterygopalatine fossa posteriorly. So that was the optic canal, the SOF, the IOF, and this is the infraorbital foramen. Through that it can escape. So the normal common route for the juvenile nasopharyngeal angiofibroma that enters into the orbit is mostly through the inferior orbital foramen or the inferior orbital fissure. So as a skull-based surgeon, we always have to look for this orbital area as well. So many orbital tumors have access to different parts of the brain through these foramens. Okay, so that was the clinical importance you need to find. In case of a teardrop fracture, in case of a blowout fracture, the inferior wall is most commonly affected. Actually separates the maxillary sinus from the orbit. So that's one clinical significance. The medial wall actually separates the orbit from the nasal cavity and the skull base in the midline. The superior, that's the roof. It actually communicates, or you can say differentiate the orbit cavity from the frontal sinus and the frontal lobe of the brain in the anterior cranial fossa. And the lateral wall basically differentiates or separates the orbital cavity from the temporal fossa actually. So this orbital cavity acts as a four-sided bodyguard for the orbital contents, that is the orbital muscles, the eye globe, the optic nerve, so the orbital fascia, periorbital fat. So everything is protected very closely from all the sides. So I think this is a proper bony anatomy that you guys need to understand. So I hope this video was of real help for you guys. And if you like the video, leave a like behind and subscribe to my channel for more exciting videos. Till then, take care guys. Thank you.